Okay. Hi, my name is Talia. Welcome to Talia Nerds Out. I'm going to apologize in advance for any shifting around, repositioning. I've been a little bit more pain today. Not sure if it's Ehlers-Danlos being Ehlers-Danlos or weather coming in. Regardless, it's there. But I just wanted to create a second video for today for the Big Book Summer Challenge for 2024. I talked about the other books that I'm reading right now in the last video, but I figured that this one isn't everyone's cup of tea, so I would do it in a video by itself. So maybe this video will be a little bit shorter. The book is called Disjointed, Navigating the Diagnosis and Management of Hypermobile Ehlers-Danlos Syndrome and Hypermobility Spectrum Disorders. So, as previously mentioned, I do have Ehlers-Danlos. I also have the other parts of what's called the trifecta. So Ehlers-Danlos is often connected to postural orthostatic tachycardia syndrome, also known as POTS, and MCAS, mast cell activation syndrome. They tend to be together as a trifecta. And Ehlers-Danlos is a connective tissue disorder that causes you just are a little bit more stretchy, for lack of a better term. And there's different forms of Ehlers-Danlos. The kind that is being referred to specifically in here is the hypermobile version. And that is the version that I happen to have. That is the reason it probably looks like jewelry. A lot of people think it is jewelry. These are thumb splints. If I don't have them, I tend to hyperextend either that way or really flat here, and it makes it so that way it can be painful to write or hold anything if I have it for any period of time off. So this little part here keeps me from going too flat. Now, if it moves around too much, yeah, I can do it. I can still if I really force it, but on a normal basis, I probably need to tighten this chain a little bit actually, but on a normal basis, it does stop me from just automatically being able to go as flat as I possibly can. So I have that on both thumbs to decrease that hypermobility. And all my fingers, all my different joints are hypermobile, but those are the only ones on my hands that cause a great deal of pain or affects my functioning if I don't have the splints, or the braces rather. So this book is actually probably meant more, at least at the beginning, for someone who is in the early part of their diagnostic journey. This book wasn't around when I was in the early part of my diagnostic journey. This book came out in 2020. I was diagnosed, I want to say it was 3 years prior to that. So I'd already become too disabled to work by the time this book came out. And I had already had my first spinal surgery at that point. So I needed a C1, C2 fusion because of instability in my spine related to Ehlers-Danlos. So this book did not come out in time for me when I was first on that diagnostic journey. Not that I would have necessarily known to go looking for it, even though looking back, I had symptoms as far back as childhood that I just didn't register as not being normal. So it goes through how to get if you think you've dysautonomia, if you think you have Ehlers-Danlos, talks about that. One of the things it discusses is places that they screening for POTS and Ehlers-Danlos and things like that might be helpful. That places like pediatricians, because this a lot of times when it shows up, it first time show up in childhood, although there are people like me who don't have it show up in a very more severe fashion until adulthood. I didn't have it really smack me in the face and knock me down until I hit 30. I didn't know I had anything really wrong with me until that point. But Um, so it talks about pediatrician's office, connect screening, orthopedic or physical therapist, and they mentioned psychiatrist or psychologist's office during intake. And I really wish my final job, okay, I was a nurse. I worked as a nurse for about 10 years. And when I became unable to work in the hospital anymore, I ended up moving to outpatient psych. And I wish that I had thought to do screening for this when I was doing outpatient psych. Now, there were points where someone would mention symptoms, and I would say, hey, you might want to consider, every once in a while something would hit, and I'd be like, hey, this is the doctor that I see, you might want to get checked out for this. Might not be it, but might not be a bad idea to get checked out. One coworker that I worked with, her daughter got diagnosed because some of the symptoms sounded eerily familiar, so I gave her my doctor's name, and she went, got her daughter diagnosed, and lo and behold, her daughter did have, I don't think she had Ehlers-Danlos, but she had POTS, and I think it was, I can't remember what the other stuff was that she had, but regardless, I have found that in my professional experience as well as personal, medical and psychiatric professionals can be a little bit too apt to discount symptoms that patients are reporting as being either anxiety or just attention seeking or something like that. And it's almost like if they haven't heard of it or if there aren't any answers, a wall goes up and they don't hear anymore. And from personal experience and from experience of watching, even, doctors, nurse practitioners that I worked with, I could see them, if I had a patient who was mentioning, yes, I have this unusual condition, I'd look it up and it would be an actual condition. She had a diagnosis, but I could see my nurse practitioner, psychiatrist, whoever it was I was working with, I could see the walls going down, like not down. I could see the walls going up. Like she wasn't listening more. In her head, she already had made up her mind that, and things I really liked her in other areas, I just could see there tends to be a bit of a closed-mindedness. Looking back, I can see that patients that would be assumed to be drug seekers, and we did have drug seekers who would try to smuggle syringes and talk their roommate into letting them get into their PCA for pain medicine, the roommate's PCA for pain medicine. But there were also patients where looking back, I'm like, I bet that she had POTS or Ehlers-Danlos or some of these other things, but the knowledge wasn't there for the medical professionals because these conditions are still considered either rare or underdiagnosed. And so it's not necessarily well known unless you're a specialist, although it's becoming more well known. And I can look back at patients and be like, I bet you had this and no one listened to you. And I never minded having that patient because she was nice. She just had a bunch of stuff going on. I never understood why other people had their minds made up about her. Still think about that patient sometimes. Anyway, and it talks about just various things about just information about the different forms of Ehlers-Danlos, the genetics behind it. Now, one of the most interesting sections is on physical therapy, and that's currently where I'm in. It's talking about how, just want to make sure I didn't write any other notes that I wanted to make sure I mentioned, but okay. So there's a section where it talks about positioning and posture. So for someone with Ehlers-Danlos, connective tissue is stretchy. So it makes any part of your body with connection to connective tissue, your spine, anywhere. It's spine, joints, etc. It's going to make it less stable. Some people will have more joint dislocation. Some people will have more issues in the spine. It will look different for different people. My issues tend to be spinal. My knees tend to be a problem. And even though I haven't had subluxations or dislocations much since I was a kid. I had dislocation last year, but it popped itself back in. Regardless, wherever you have connective tissue, there is more of an issue to possibly develop. Now, I'm going to be focusing on hypermobile in particular because that's what this book is focused on, and that's the one I know the most about. It mentions posture as being particularly important because if you mess with your posture, the muscles are having to do more work to try to keep your connective tissue from being pushed too far to the point that you end up dislocating something, having something subluxate? I'm not sure how you would say that. Anyway, so one of the things it shows, and I thought this was particularly interesting, so it says one common problem caused by postural faults, so faults in your posture, is forward head position. So that's like you're hunching your shoulders and head forward. In this posture, for every inch the head moves forward, the weight of the head on the spine increases by an additional 10 pounds. People whose head is sitting 3 inches forward of their shoulders are now supporting 42 pounds of weight, compared to what is typically 12 pounds in an aligned posture. It can occur in both sitting and standing postures. It can pull the spine out of alignment, reduce lung capacity, and thus inhibiting complete lung aeration, contribute to a sluggish gastrointestinal system, can cause tension headaches, and decrease balance. Now, I'm a bit of a person who hunches, which, as someone who has instabilities in my spine, that's a really bad idea. So this has reminded me to focus on posture more and to remember that, even something as simple as when you're tired, hunching a little bit too much, if I do that too much, you can affect the instabilities in your spine. Or, create some if you are someone with Ehlers-Danlos and you don't currently have any instability at that point. Don't risk it. But it's also just good knowledge in general, even for the average person, to know that you're putting that extra weight on your neck that you don't need to. The other thing that was really interesting in here is they're talking about hyperextension lower extremities, specifically in the knees. Now, this isn't even the most extreme example. So a normal person is like this. Normal person knee. And this is actually a rather mild form of hyperextension. I go back far more than that. So when I stand, let's see, my knee juts out like that. Instead of, going forward like that, it's completely opposite direction. It actually looks really creepy. Makes me look bow-legged when I stand at my most comfortable position, which is hyperextended. Now, something I thought was interesting here is it mentions that kind of hyperextension can actually cause flat feet, which I have, and my dad, who also hyperextends a bit, even though he doesn't have Ehlers-Danlos, he also has flat feet. And it causes added stress on numerous joints and muscles throughout the trunk, spine, shoulders, and even all the way up to the cervical spine and temporal mandibular joints. So, like, I have TMJ because of Ehlers-Danlos. Not standing properly, so posture in upper body, as well as having to focus and not hyperextend all the time from my legs, which is my natural comfort zone, that can put stress all the way up the body, even up to the jaw. So they call this upper lower body cross syndrome. And it says what happens there: basic support, sitting or standing, affects the positioning of the rest of the body. So it affects your lower back, it affects, cause abnormal spinal curvatures, excessive forward head positioning, so that increases the issues back here that you have the hunched posture. So I just thought it was very interesting, this section on PT. I'm hoping once she gets to the end, because each chapter is a different specialist talking about their area of specialty and how that ties into Ehlers-Danlos and how that can help an Ehlers-Danlos patient. Now, one of the things that this talks about is as well where you can trap nerves or arteries. Now, this came into an issue for me with the spinal instability at C1, C2, because of subluxation. When I would turn my head, I would get the vertebral arteries, so the arteries along the vertebrae, pinched, completely blocked off. And if I did not have blood flow through my aorta, through my, why's my brain not working? Carotid arteries, I would have probably stroked because I had my blood flow blocked when I would turn my head, which was why I felt like I would pass out so much. So just the things that some things that I was blaming on POTS were actually Ehlers-Danlos related, although POTS was involved too for part of it, but because there was an instability of spine, which probably is exacerbated by the fact that poor posture on top of other things. So I just thought it was interesting, just all the different ways that maybe it gives you a little bit more of a feeling of control. You can't change the way your body is made up. I can't make my tissues, my ligaments less stretchy. My cartilage is what my cartilage is. But with posture, I can perhaps decrease the damage. Maybe I can go more than 5 years without a surgery, because I've had 2 in the past 5 years, 2 spinal surgeries. C1, C2 fusion, and then a tether cord release surgery, which tether cord, fun fact, you see a lot with spina bifida kids. It's actually, they will, even though they don't mean when they say that someone who has tether cord for Ehlers-Danlos, when they say they have spina bifida, it's just the description of the way that it looks on imagery. They aren't saying you have the condition, the spina bifida, the way that you mean, where that's the main condition. I'm not sure if I'm expressing it well. But yeah, this is a very useful book. There's a lot in here, especially for someone like I can implement some of these changes in spite of the fact that I am pretty much homebound. If I leave, especially for any extended period of time, I will overstimulate if I go to physical therapists to the point where I will be either so wiped out when I come home, or I will end up in tears by the end because I will be so exhausted just from being there. So having something that could potentially help me figure out some of these things from home myself. Looks like they have some exercises, which is great. Just some things that could help someone at home, and some tips and tricks. So yeah, this physical therapy chapter was actually one I was really looking forward to. The rest of the book I'm sure will be very good too. But that's just a really quick rundown. I didn't think that the average person necessarily who doesn't have a deep interest in Ehlers-Danlos would necessarily want to, or deep interest in medical in general, be interested in hearing about this book. I've learned the hard way that no one is as interested in my medical conditions that I know as I am. So I generally take advantage of whatever chance I can to talk to people who either have it themselves, particularly if they're medical professionals, who have it themselves and want to talk about it, or who just happen to have an interest because they are a provider. When I go to a doctor's appointment, I happen to feel well enough. I actually enjoy going because I can actually discuss medical conditions and theorize and talk about it in a more detailed way. Because even among fellow patients, I find that different people cope in different ways. And for me, one of the main ways of coping has always been to take a very clinical view of it, even though I'm going through it right now. If I can almost divorce myself from it to a certain extent and look at it from a clinical perspective, I can appreciate how fascinating these conditions are, and really how marvelous the body is in how many ways that if you have just a couple things go wrong, how it causes a cascading effect that can affect the whole body depending on what system you're dealing with. So if you have a connective tissue or disorder, you don't realize or think about how much of your body is affected by connective tissue until all the connective tissue in your body are affected. You don't think about with mast cell, how the immune system, when just a little bit of it overreacts, how that can have an effect all over. With POTS, which is actually a neurological disorder, autonomic nervous system disorder, so a dysautonomia. Your autonomic nervous system covers everything that you don't have to think about running. So your heart rate, your breathing, your digestion, your vascular movement. All these things you don't have to think about. The person with dysautonomia, those things can go kaput because the autonomic nervous system is out of whack. So it brings more to perspective what each of these systems are really responsible for. So it's really kind of cool, but not cool at the same time. So I always look forward to and enjoy discussing these things with people who are as interested as I am, or, well, in case of this being on video, it doesn't, if you aren't interested, you can just click off and I still got to talk about it. So, win-win situation, even if it's only, me blathering at a screen. So, yeah, I just find the human body to be absolutely fascinating. And, yeah, that's it for Disjointed. It's early in the morning. I need to recharge my watch and close this because it's med time. I'm on a bit of a flip schedule. I worked night shift for many years. I worked it for my entire career as an RN and even a bit as a CNA when I was in high school. I liked the consistency of the schedule. I liked the fact that, doctors weren't, in my way with the patients and that management wasn't around. So I preferred night shift. And now with the fact that I get overstimulated easily, and that's a mixture of mast cell and POTS, the fact that I get overstimulated easily means that I tend to gravitate toward my body's old night shift rhythm. So I'm at my most comfortable and happiest at night. So I do a lot of my sleeping in the middle of the day when I'm most overstimulated. Anyway, that's it, I guess. I don't know if anyone watched this particular video because it is far more Ehlers-Danlos than I think the average person will be interested in. But if you did make it through, thank you very much. I hope that you weren't driven too crazy, that you didn't get too glassy-eyed or annoyed. But thank you very much for staying, and I will see y'all next time. God bless. Bye-bye.